Welcome, and fantastic to have you all engaged today on this very important topic. And we have a great panel of speakers and consumers with us today to talk about how we have a healthy transition and plan from before pregnancy, through pregnancy and beyond, both for health and also for career transition, all of which is very important. So I'd just like to begin today with acknowledging the traditional custodians of the land on which we meet today, and pay my respects to our elders past and present, and I extend this respect to Aboriginal and Torres Strait Islanders who are here with us today. And of course, I have a dog barking in the background just because we're all in the lived environment of multitasking where we work. So I'm just going to introduce your fantastic panel here who we have for you today, and just to highlight that we're really very, very fortunate to have so many experts speak with us today, and mainly to be able to answer all of your questions and answers. So just to run through the group, so we have in no particular order, we have Associate Professor Kirsten Palmer, who is an obstetrician and a specialist in complex pregnancies, who does a spectacular job looking after mums who have very complex pregnancies. We have Mary Musa, who has a background in psychology and business and has done a PhD in career and progression of career for women. We have Associate Professor Lisa Moran, who is a dietitian and also working in preventing risk for women through healthy lifestyle, a proper range of stages in reproductive health. We have Nicole Hyatt, who's the founder and CEO of COPE, who has also got a background in psychology and around mental health for women in all life stages. We also have Daniel Rolnick. So Associate Professor Daniel Rolnick is an obstetrician at Monash Health, like Associate Professor Palmer, and has a significant research program, as do everybody on this call, in optimising women's health. And importantly, Leslie Arnott, who is the chair of the Consumer and Community Involvement Committee for the National Women's Health Research Translation Network, the spectacular advocate for women's health, and Dr. Cherise Harrison, who is a health coach and exercise physiologist and research fellow who works with Monash University and optimises health for women during pregnancy and beyond. So just to get on and have a run through, if you like, about what's most important over this time. What we're going to do here in the format is each of us are going to give some key tips and actually run through just the most important high-level tips that we think are really important for women to know as they're thinking about going on this journey, and then also to then come back mainly to your questions and answers. So I'll go around the room, so to speak, and we'll get everybody to just do their top tips. Just to remind you, we are tweeting during this, and the social media hashtags and Twitter hashtags are in the chat box if you wish to use them. So I'm going to just ask all the panelists now to just give their top tips. I'll start with Associate Professor Kirsten Palmer and reducing risks in pregnancy. Kirsten.
No worries. Thank you so much, Helena. And it probably won't come as a surprise, but my first top tip begins actually before pregnancy, and it's really around optimizing your health pre-conception. And so using this as an opportunity to stop smoking, if that's something that you're currently doing, and to look at ideally kind of stopping and minimizing alcohol and other drug use. It's also really beneficial at this stage to go and visit your GP or your obstetrician for a pre-pregnancy visit. And this can involve just a general health checkup. But if you do have any pre-existing medical conditions, it also enables you to have that chance to really optimize those health conditions prior to pregnancy. And this is important because we know that some of these conditions can have a really significant impact during pregnancy, and you may be on medications for these that might not be safe in pregnancy either. And so it gives you a chance to try and optimize these before pregnancy. It's worthwhile at that stage also having a cervical screening test if that's due, and antenatal bloods that can guide whether you should have a rubella booster pre-pregnancy. And if they did find any any medical conditions on those antenatal bloods, such as hepatitis C or syphilis, we have really effective treatments for both of these conditions that we can use prior to pregnancy. The second tip is to commence folate supplementation if you are planning a pregnancy. And the recommendations are to be on at least 400 micrograms of folic acid every day, ideally starting this from at least 1 month before conception, but we know that starting it even a few months before that can still provide additional benefits, and then to continue on that throughout the first trimester. And this really reduces the risk of your baby having a neural tube defect or something that can affect the way that the brain and the spine develops in that first trimester. And my last tip for pregnancy is then to engage with your GP and get a referral for regular antenatal care throughout your pregnancy. And this really should begin in that first trimester. And we know that having regular antenatal care, whether that's shared care with your family doctor, care with a midwife, or with an obstetrician, we know that care across these different modes really minimises the chance of having risks and complications in your pregnancy. And it's an opportunity as well to have that discussion to ensure that you are receiving that antenatal care in the right place with the right health professional to meet whatever your individual clinical needs might be. Thank you.
Thank you very much. And so we'll then move over to, now I've just lost the right sheet. We will actually then move over to Dr. Cherise Harrison on healthy lifestyle approaches before and into pregnancy. Cherise.
Thanks, Helena. So I'll dovetail off Kirsten, and I think I'll focus a little bit more on health during pregnancy. And so we know that health during pregnancy can shape the health of both mother and baby, not only during pregnancy, but in the years that follow. One of the strongest links with health outcomes during pregnancy is weight gain during pregnancy, which can be really accelerated in a high-risk time for women in terms of how much weight gain they have during pregnancy. So the first tip is to make sure you're linking with your midwife and obstetrician to really understand what the weight gain recommendations are during pregnancy. And all women have a personal weight gain recommendation based on their pre-existing weight prior to pregnancy. And that also comes with the tip around monitoring your weight regularly during pregnancy, whether that's in conjunction with your obstetric team at the hospital or at home. It's really important to monitor your weight. We recommend weekly, just to keep an eye on how that's tracking during your pregnancy. The second tip related to your health during pregnancy really comes with the notion that during pregnancy, women tend to want to do the best to ensure good outcomes for themselves and their babies, but it can be a really overwhelming time. So understanding what we can do and where to start, it can be a really overwhelming prospect. So my tip around that, for tip number 2, would be to focus on small but achievable changes you can make to your lifestyle during pregnancy that are both realistic and achievable and in line with realistic expectations. So focusing on small but achievable steps towards a healthy diet and physical activity. And then my third tip is around exercise. So exercise is a really common barrier during pregnancy for women. It's often harder to achieve regular physical activity in comparison to making healthy lifestyle changes related to diet. But physical activity is really important, and it has really strong health outcomes related to blood pressure, stress during labour, coping mechanisms, and emotional well-being. So just starting again with realistic expectations, just around fitting in. It doesn't have to be overly complex or fancy, just starting with regular walking, if you can, a few times a week for 20 minutes, even just once or twice if you're finding it difficult to start with, and building up from there as a main way to sort of boost your physical activity during pregnancy would be my third tip. Thanks, Helena.
Great. Thank you very much, Cherise. And so we'll go over to Dr. Daniel Rolnick and talking about healthy pregnancies and reducing risk. Daniel.
Thanks, Helena. And I think a lot of what I was going to say has already been said, but my first tip was to continue that folic acid that Kirsten already mentioned throughout the first trimester of pregnancy. We know that leads to a huge reduction in fetal malformations and reduces the risk of anemia for the mother. So that's one of my tips. The second one was to the antenatal care, the importance of antenatal care. We have very large, very well-conducted studies showing that antenatal care really makes a difference and optimizes outcomes for mothers and babies. And to develop a good relationship and a good bond with your healthcare provider so that you can ask your questions, make sure you get a reliable source of information. We've been having a lot of trouble now with social media, and which is good, and it's also bad because there's a lot of misinformation out there. So there are many good sources of information available to families, and we need to make sure we get the most out of them. Important to also attend your ultrasound examination. So we know that these are important checks to make sure that the pregnancy is going well and the baby is developing as we would expect. I was going to talk a little bit about weight gain, and that depends very much on your starting weight. We know that there are many pregnancy complications that can be associated with excessive weight gain. So make sure to ask your midwife, your GP or obstetrician, what would be the ideal weight gain. We know that for the vast majorities of the pregnancies, exercise is not contraindicated, and we recommend a healthy, balanced diet with small meals a few times a day, but I'll leave the diet for Lisa to talk about. And my last tip, my last comment was going to be about vaccination. So there are some vaccines that cannot be given in pregnancy, but there are some vaccines that we know that they are recommended, and there has been a lot of studies on their safety, and they do improve outcomes for mothers and babies. And these include the whooping cough vaccine and the flu vaccine, and now the COVID-19 vaccine. So there is a lot of emerging data on the COVID vaccine as well, showing that this is safe in pregnancy. We know that these diseases tend to be more severe in pregnant people than in non-pregnant people. So being pregnant is a risk factor for having bad disease if you get one of those infections. And we also know that if you get these vaccines during pregnancy, you pass protection through the placenta for the baby, and the baby will be protected in the first 6 months of life. So for example, whooping cough, we know it can be quite bad in small children, and kids don't tend to get vaccinated until they are 6 months of age. So it's important to get vaccinated, produce those antibodies to protect yourself as well as your baby by passing those antibodies through the placenta. And these are my tips.
Thank you very much, Daniel. Nicole Hyatt, would you like to give us some top tips about mental health and wellbeing? And also note, we'll put some resources in the chat as well on this. So Nicole.
Great, thank you very much. So my top tips, the first one is to be mindful of the fact that emotional and mental health is as important as physical health when it comes to this life stage. We know that this is one of the most vulnerable times in a woman's life, particularly when she's most likely to develop a mental health problem. So conditions like anxiety and depression are likely to occur for the first time or relapse if a person has a pre-existing condition. And this is also true for people who might be experiencing infertility and going through infertility treatments. We know this can be an emotional roller coaster, which also leads to high levels of anxiety and potentially depression as well. And then there's long-term impacts. My second major tip would be understanding as a community, as individuals, that often the signs and symptoms of these common conditions are missed because they're often misattributed and put down to just being part of pregnancy or just being part of having a baby. It's just hormones, it's just sleep deprivation. So it's really important we educate ourselves about emotional and mental health. And here COPE has just released in the App Store or Google Play the Ready to Cope guide. The national guidelines recommend psychoeducation around these issues throughout pregnancy in the first year. And this free app will make sure women have access to this information each week throughout their pregnancy and first year. So it's making sure you've got timely, relevant information to keep abreast of all these changes and challenges that might come along the way. The third point is that because these conditions are so common, screening for mental health conditions is imperative. And again, the national guidelines recommends routine universal screening for all expectant new mothers and just like we screen for diabetes and blood tests and ultrasounds, we also must be screening for mental health. So for professionals, putting up the top of the list, and we also have new digital ways of doing this to the woman's own phone to make it more effective. But also, and we know that screening is not being undertaken enough in the private sector. There's a long way to go with increasing rates of mental health screening in the private sector. But early recognition and detection is absolutely critical. So that will be my third top point.
Thanks so much, Nicole. Really important messages. And Associate Professor Lisa Moran, who's going to tell us a little bit about healthy lifestyles we come out of pregnancy and start thinking about others more than ourselves, especially in the family context. Lisa.
Yes, so we've heard about the importance of optimising lifestyle and health behaviours before and during pregnancy, but there are also enormous benefits to following a healthy lifestyle after giving birth, and this is both for your own health, so this can reduce your risk of infertility in a subsequent pregnancy, but also reduce your risk of pregnancy complications and improve the health of your baby in a subsequent pregnancy. But having a healthy lifestyle after giving birth can also improve the health of yourself going forward and the health of your family. So it can create a healthy food and exercise environment for your children and for yourself and your partner. And it can also reduce the risk of lifestyle-related diseases such as longer-term diabetes and heart disease risk. But we do know that the time after giving birth is a time when many women have many demands on their personal time. And these come with the responsibilities of raising children and managing the household. And these often affect women more than men. And these are often understandably prioritised over a mother's personal health. So all these new challenges can make it really difficult for mothers to make healthy lifestyle changes. And these are challenges either for new mums or mums with older kids. So I've got a 4 and a 9-year-old myself, and even as a dietitian, I struggle to fit my own health in my lifestyle above the priorities of my family. So one key factor associated with improving a mother's ability to make healthy lifestyle changes is their support and their cooperation from their partner and their family. And so this means really it's about learning how to parent together with your partner. So both parents ideally spending time both before and after their baby is born to explore ways to work together as a parenting team to both raise happy and healthy kids, but also stay happy, healthy as parents. And these are skills that parents can learn and practice together to strengthen themselves as a parenting team. So just as we don't instinctively know how to look after a newborn baby, and I certainly didn't, we also don't instinctively know how to work together as a family. So my top tips here are key concepts to discuss with your partner before having kids and in the early days of having kids. So we want to work out our agreement on how we're going to raise our kids, work out what our childbearing and rearing principles and practices are, and if we have the same principles and practices, or if we disagree on some issues, and talk these through. We want to work on focusing on supporting each other rather than undermining each other in parenting duties. And we want to work on trying to divide parenting tasks fairly as well. So really it's about starting discussions on what parenting looks like, what your expectations are for parenting, and keeping your communication channels open. So, some tips here could be also, having an open discussion about what you think you're going to do well as a parent and your partner, but also what you and your partner think maybe you might not do as well, and brainstorming together options to strengthen this. Having an open discussion about what chores you think each of you will do, and make this really practical and realistic, and maybe brainstorm solutions where you can assist each other. Having open discussions about how you communicate together in situations of conflict. So maybe brainstorm a particular parenting related issues such as discipline, or one of you getting resentful of doing too many chores. So write down maybe how you communicate now, what you maybe don't do as well, and what you want to try and do well in the future, because you're going to be sleep deprived, you're going to be exhausted, and you want to be not working through this in that moment, you want to be working through it now. And then finally, I think about what's important to you in having a healthy lifestyle. So whether it be diet, exercise, stress management, time for yourself. So what is at least one key part of your lifestyle that you want to prioritize after having kids, and how you're going to fit this in practically and plan and structure and timetable this with your partner. Thanks, Helena.
Thank you. Really important advice, Lisa. Leslie Arnott, who's our consumer advisor and leader in maternal services. Leslie.
Thanks, Helena. When I was asked to give some tips on this, one of the first things that came to mind was some of our wonderful cultures here in Australia who have the most stunning practices in caring for a mother who's just had a baby, which is pretty incredible. And my tip to you, if you're in one of those cultures, is actually to really, really embrace it. It's important, and it provides enormous support, care, safety, love, all those types of things that we need to have around us as a mother when we first become a mum. And our world can tend to teach us, that we have to hit the ground running after we've had a baby. And I work in the health industry, actually, in the fitness industry. And one of the things that I say to some of my clients who come to me who are pregnant, I actually say to them after, towards the end of their pregnancy, I don't actually want to see you for about 3 months after your birth, because that bonding time with your baby and the time to nurture yourself and recover from birth, because it's a big event, is really, really important. So I absolutely encourage women not to hit the ground running, even if it's in a short time. And I understand that some women may need to get back to work and all those types of things, but even if it's in the short time, it's really, really important to actually nurture the time that you have with your baby while you have it. My other tip that I would say is don't be afraid to ask for help. Those around us will want you to do that. Sometimes it's a juggling act even for those people around us, because they want to protect the space that you have and your privacy and all that type of thing. And sometimes they're not going to know. So I would say put your hand up and ask for help whenever you need it. There can be a lot of societal pressures on new mums and parents to bounce back. And I say, just try and ignore them and enjoy the slowness, of getting to know and care for your baby. The other thing I'd give a tip about too, and it probably echoes Sharice's talk as well as Lisa's, is that physical fitness is important, and it's important before pregnancy. So a lot of women will come to me or will start exercising when they become pregnant. It's really, really important to start beforehand. And I think we've actually said that before. And, becoming physically fit or fitter than what you are doesn't actually have to cost money. You don't have to join health clubs and all that type of thing. Walking is free, riding a bike is free, doing exercises in your home. There's heaps of YouTube clips, so you can use those as well. The other thing that I'll say too is doing gluteal exercises, buttock exercises, because it indirectly affects pelvic floor, and that can actually really put you in good stead before and after birth. I always give tips to people who ask me about pelvic floor exercises, and I say you can do some pelvic floor exercises every time you come to a red light in the traffic. The other thing too I would say is find out the benefits of breastfeeding if indeed you can. Breastfeeding is not only nourishing for your baby, but it's also nourishing for yourself. It does help with weight loss. And I just love the fact that it releases that love hormone called oxytocin. My husband and I say that, God, if we could bottle that stuff and sell it, we'd be millionaires. It's just the most beautiful hormone on the face of the earth. And as I said, breastfeeding can help with decreasing weight. And I would also say, look out for ABA, Australian Breastfeeding Association. They have an incredible support organization, and they're in the community, which is quite extraordinary. And they have people on 24/7 working on help lines, so that if you have any problem, if it's 2 o'clock in the morning, you can pick up the phone and call them. It's a brilliant organization. And it's community-based. You have them right in your neighborhood, which is fantastic. So those are my tips.
Thank you very much, Leslie. Very insightful as always. And importantly, Mary Musa, who's just going to get us to think about, so you've heard a lot about planning. If you're thinking about having a pregnancy, it's not just something that should happen. It needs planning and getting healthy beforehand, healthy during, and transitioning into healthy after. And so we're now going to hear from Mary Musa, who's going to tell us a little bit about thinking about your career across this trajectory. So it's not just something that happens to your career, but something you plan around. So Mary.
Thank you, Helena. And after listening to everybody, there's so much to think about along your physical health, your mental health, your emotional and social health. And so when it comes to thinking about career, what we often find is that it's at the very end. It's not as important as everything else for the pregnancy itself, but it's something that tends to rear its ugly head at the other side of the pregnancy, where you're confronted by the reality of going back to work. And confronted by the realities of actually having to do that while also having all this new physical and caring responsibilities that you didn't have before. So thinking about what the top 3 tips that I would want to give were, I went around and talked to a few people just to kind of get an idea of what might be relevant to this particular type of talk. And someone said something to me that I want to share with you, and it was that one of the most monumental experiences in a woman's life is going through this transformation. And it's described in your average grant application or a job appraisal as a career disruption. And there's something fundamentally wrong with that. But it's the reality of the experience that we're all kind of going through at the moment as mothers or mothers-to-be or planning to be mothers. And so that kind of gives us a glimpse of what it might be like when women in general or women with children or other caring responsibilities, the kind of biases and misconceptions about their capability to perform at work, the judgment calls that they might be coming up against around their capacity to perform certain roles at work or to take up certain hours or to do certain positions, which kind of also leads to unfair assumptions about their credibility. And so what are 3 things that you could do now to plan for that, even at a very high level? And so a really good place to start is to start thinking about what it is that you truly want for work and for your life once you have children, or if you've already had children, then looking at it as it is in the reality that you're living every day. And so what it is that you want for work and for life, and being really explicit about it. And this often starts with really understanding what your why is. What are your needs? What are your motivations? What are your beliefs that drive what you do every day? Create a priority list and capture this information in a way that will really help you facilitate those conversations with your workplace. Often, because we're on the receiving end, and we're confronted by the reality, what we end up with is kind of seeing what is available to me, what can be done, as opposed to going in with an idea of what it is that we truly want in those conversations. And so tip number 1 is to capture what it is you want in order to be able to facilitate those conversations clearly and transparently with your supervisor, your manager, or your workplace in general. And the second tip is to really think about what have you been doing every day to achieve the things that you want to achieve? So what are the processes? What are the actions that you've been taking to realize your why around work and to meet your needs at the moment? And what you'll find as you start to list through these things is where the gaps fall. What are there things that you're just not meeting just because you have too much to do? Do you need to outsource? Do you need to share the mental load? Do you need to ask for flexible arrangements? And so in order to really find out what those things are, it's important to sit down and figure out what is it actually, how have you been doing the things? What are the processes that you've put in place in order to meet your needs? And finally, the third tip is, what do you actually end up with? What are the results that you're living with, the proof of your actions that form your reality today? And so what are things that you see in your everyday life, whether it's good balance or time with your children or having time to develop your personal or your professional identity? What are the things that you're seeing today that actually are the results that you want to maintain? And what are the things that you're not seeing that are the results that you want to start working towards? And so working through these 3 things, what you do is you have a clear picture of what you really want from your career, what you're actually doing to get what you want for your career, and then what the results that you need to be working towards are. And this helps you put together a really clear course of action to facilitate that initial consultation around what a career might look like for you specifically after you have your baby or whatever. Okay, and that's all for me.
Thank you very much, Mariam. Said with so much passion and interest. I wish I had that advice before I had my own children. It's a bit like you can either decide across this transition to be a passenger in a car that is just taking you on a journey. And there are times in the journey where you need to do that, or whether you actually want to sit in the driver's seat. But on that discussion, one of the biggest things about this journey is that we all know, or should know, that just deciding we might want to have a family doesn't mean we can. Immediately or over a period of time, many women and couples need help. Indeed, up to about 15% of Australian couples or women now experience infertility. And so we're just going to very briefly touch on that. And I might just open it up to general questions, but I might start with Kirsten and Daniel if you want to comment. But just in terms of, if you're someone who is having difficulty, when do you need to start being concerned about potential infertility? Where do you go for help first? And then I'll pass over to Nicole to make some points about that. So perhaps Kirsten, did you want to just make a few comments on that?
Sure. I mean, the general advice would be to allow 12 months from when you're beginning to actively try to conceive. And, you know, for that, obviously, that's having regular unprotected intercourse around that time of ovulation in the cycle, and waiting for 12 months with that before going and seeking help with your GP and referral on to an infertility specialist for further investigation and workup as to what might be impacting on why you might not have conceived after 12 months. There are some caveats to that. So for women who are over 35 and a little bit older, the recommendation would be after 6 months. And likewise, there may be people that are already aware that they're going to have medical issues that are going to impact on their ability to childbear, such as people that have previously had chemotherapy or radiation therapy for cancers, that may have had surgical procedures that we know are going to impact on their fertility. And obviously in those circumstances, it's important to individualise and get those referrals sooner.
Great. And yes, obviously there's quite a few women out there with polycystic ovary syndrome too, very common and very often need some support. But as Kirsten said, starting with your GP first is terrific because there are some simple things, and all those wonderful preconception checks that you all talked about can also happen at that time. Daniel, did you have anything to add before I hand over to Nicole?
Yeah, I think Kirsten already said the times that we look for and what the definition of infertility is. I think it's also important to understand that once that referral has been made, there is a series of investigations that are important because there are multiple causes of infertility and not all of them will require IVF. So some causes, like you said, polycystic ovary, sometimes you may optimize your chances of getting pregnant by optimizing your health in general and sometimes losing a bit of weight, and there are some lifestyle changes that can increase a bit your risk of your chances of getting pregnant without too much help. And even within the help we can give people to get pregnant, there are different levels of help.
Yeah, definitely. In fact, on that point, the first line treatment for women with polycystic ovary syndrome, for example, is actually medical oral therapy, not IVF. It's only indicated as third line. So really important that you're educated, and we'll put the resources in the chat there, but Your Fertility is a fantastic evidence-based, and we would really encourage you to access evidence-based information, but very supportive information, and we'll put a few resources in the chat there. Nicole, for women who and couples who are going through infertility, it's incredibly distressing, traumatic, challenging, the not knowing, not being able to do something that we all just assume we can do. And then obviously once you're in the merry-go-round of hormone treatments, the ups and downs, the disappointments, the successes, it's incredibly difficult. And I know that you're doing some work in that area. Did you just want to comment about that support?
Yeah, look, just to remind people that it can be an emotional roller coaster. It can lead to higher rates of anxiety whilst trying to conceive, and obviously dealing with potential losses that might result from miscarriages. These can all take their toll on emotional and mental health impacts. I really encourage people to look at the Truth campaign, thetruth.org.au. There's a whole section there about the truth about living with infertility, and you can then find access to counsellors and specialists who really specialise in that area to provide you that emotional and mental health support.
Great, thank you. All right, in terms of other questions that we've had in here, some of the things that you could or should be considered in the first few weeks of pregnancy, and where you might find reliable information on that. So obviously we can all go to our GP, really important, and there's other reasons why we might do that. But in terms of other resources, Nicole, you can perhaps refer to the COPE resources, because this is a transition time. In terms of other sources of information, anybody would like to specifically, I think Leslie, you also want to comment on that. So perhaps Nicole and then Leslie and then anybody else.
Yeah, I'd look, going to the COPE website will give you a whole range of resources across each stage of the perinatal period. So from preconception, pregnancy, the time around birth and the postnatal period. One of the things around the time immediately after birth, often we experience the baby blues. This is very common, but obviously if that hasn't subsided on its own, it can be an indication for postnatal depression. But often people think it's just the baby blues. I'm waiting for the baby blues to go away. So being mindful of the difference, and again, just re-emphasising from my tips, this is why screening is so important, so that we can identify the difference and make sure that people get help early. We know that 74% of women don't seek help for anxiety and depression until they reach crisis point. Early intervention and treatment can really prevent a decline here. So getting onto it earlier is as early as possible is the best thing we can do, and that's why screening is vital.
Great. Any other quick final comments on that one? We've got quite a few more questions. So
I've got one, Helena. One of the things that I found enormously enlightening, and you touched on it before too, it's really important to find evidence-based information, which is terrific. That's quite robust. And there were two things that I highly recommend for women to read before or during pregnancy is the World Health Organization's Care in Normal Birth. And even if your pregnancy is outside the parameters of normal, it is a wonderful eye-opener about evidence-based care and how women should be cared for. And the other one was a guide to effective care in pregnancy and childbirth by Murray Enkin et al., which is a synopsis of the Cochrane database evidence on how to look after women in childbirth and early parenting. And it was just such a massive eye-opener for me that this evidence was culminated in these two books, and very readable, I have to say. You don't have to be a researcher to understand it. So it's very accessible. It's written in very accessible language. So those were my two tips.
Great. You might want to put that in the chat if you can. That'd be terrific. Yep. Thank you. Sure. And that actually leads into a next question on how do you make sense of the very strong narratives around pregnancy and postpartum in healthcare and the resulting conflicting advice that occurs in care? So I think the strong narratives are often from our society, our culture, our friends, our peer groups. Everyone has advice. And obviously this whole journey is incredibly personalised for you, your partner, your family, and nobody else's advice is outside, hopefully, a health professionals is going to be specifically fit for purpose. But perhaps I might just ask Daniel if you could comment on that. How do people, because one of the things they can do, obviously, Leslie, is get evidence-based advice, including the references you've talked about. Yep. But Daniel, in terms of the fact that there is so much misinformation out there and it's really confusing for women, you know, where do they trust that information? How do they deal with that?
Yeah, thanks, Helena. Yeah, so I sort of hinted about that in my tips, but I think we are living in an era where information travels really fast and anyone can give their opinion on social media. So we really need to be careful with that. And we are seeing that happening a lot with new vaccines that have been developed. So I think my recommendation goes on the same line as those from Leslie, that there is a lot of reliable resources out there. I think one of the resources I often tell patients to go and look for are the hospital systems resources that are online, both nationally and internationally. So all big hospitals in Melbourne, for example, make resource available online for patients in a very accessible language. There are some other hospitals overseas that do the same. There are some smartphone applications that are quite good and evidence-based as well, that contain information step by step during pregnancy. But every time we tell a woman that something is not quite right, or you got a slightly abnormal blood test result, the natural reaction is to go and Google and see what that means. And we just need to be careful with where we're getting that information from.
Yeah, I think, Daniel, that's a really important point. As a clinician who's managed a large number of people through the COVID pandemic, not necessarily in pregnancy, I know you've done that, but the misinformation causes so much anxiety and so much destructive disharmony amongst families. So I really, if people could stand in the health professional's shoes and watch the heartbreak, the illness that's unnecessary, the adverse outcomes that occur because of primarily well-intended but dreadfully misguided information. I can tell you that as a health professional, I would be the front of the line to get any vaccine I possibly could, because the risks are always lower than the condition itself. So thank you very much. I think that's a really important point. There's a couple of comments in the questions about mums and families who are getting older. So that anxiety of age creeping up. So where does our fertility start to decline? What do we need to do about planning? How do we manage that anxiety? I might just kick off by saying, again, evidence-based information is really good. There's a lot of great information on your fertility. There's information about age and impact of age. And there's also, it's really important to not assume that you can just keep waiting and that your fertility won't change. So one of the biggest problems, of course, is that women don't necessarily know when fertility starts to change and what the impact of age is. So Kirsten, on that, I might flick to you and then come back to Nicole, because I know you've got some comments on that, Nicole. So Kirsten?
Sure. I mean, certainly in terms of our ovarian reserve, that is something, unfortunately, as females, that starts to decline actually from the moment we're born. So it is a gradual process, but certainly when we think about fertility, we know that really does start to decline much more rapidly from once we're, in our mid-30s. Now, this is going to be a little bit variable still from one person to the next. And I think that's always something that's worth bearing in mind, in that personal circumstances can be a little bit different as well, and that this information is based on a broad general population. So, certainly the recommendations would be aiming to have children prior to 35, if possible, just to minimise that risk of going through that subfertility, infertility journey that we've just spoken about. But also being aware that as we get older, the risks of having a pregnancy that's complicated by a chromosomal anomaly or chromosomal difference really starts to increase as well. And this is going to be associated with an increased risk of miscarriage and complex pregnancies as well. And so there are lots of benefits physiologically to having children in our 20s and early 30s, but obviously from a social perspective, that may not always be possible. So I think the important thing also to recognise is, if you are over 35 and you haven't yet had that opportunity, that doesn't mean that door is closed to you at all, and the ability for having a family still very much exists. But it's definitely worth making sure that you do go and have a pre-pregnancy checkup with your family doctor, and consider an obstetrician in there as well, to further explore what you might need to do just to further optimise your chances of having a healthy pregnancy, but also being aware of what the challenges and the risks might be, so that you're emotionally a little bit more prepared for what might happen in the months, the years ahead.
Thanks, Kirsten. Nicole, did you want to add anything to that?
Just reiterating what I mentioned before about infertility, but also that there are great services available for those who might be faced with the issue of childlessness. And again, through the Truth campaign and on the ECOPE directory, our National Perinatal Mental Health Directory, you can actually seek out services who specialise in that area. That's something you are faced with.
Great, thank you. And there's also some comments there about, questions rather, about planning careers as you get to this critical life stage too. So I think that what Mariam has highlighted also becomes relevant in terms of you don't necessarily need to consider that you need to wait a long period of time in terms of career. I mean, many of us on this call have actually managed to juggle having our children in our family perhaps earlier than we thought was appropriate for our career, but knowing in the back of our mind what we know, which is that there is that biological clock. So it's just a matter of knowing. If you're not informed, you can't make informed decisions. So I think all the resources that are out there, access them, all the information you need to know, access it, make your decisions. And as Mariam highlighted, and as the evidence shows, if you put yourself in the driver's seat about your career transition here, it doesn't have to be, something that you choose, family or career. So I think that becomes really important. Now, there's an important and tricky question in the chat, and I think really important for us to address it, but also always challenging, around how should weight be monitored during pregnancy in a woman with a history of restrictive eating disorders to avoid relapse. So I might kick that off and then hand over to Lisa and then Cherise. I think just if I can kick off by saying, irrespective of whatever weight a mother goes into pregnancy, if we just put that aside, there is a healthy lifestyle and healthy increase in weight that all mums should have. Every mum. Doesn't matter what your weight is going in. Every mum needs to put on some weight in their pregnancy to be healthy, and we know that's what it is. So there's no judgment or stigma about where you start here. Where you start is just where you start. But from that point, we do know that a healthier lifestyle and understanding what that healthy trajectory is for mum and baby is worth any mum understanding. But there are real sensitivities around this, because no matter what we say, anything to do with weight in our society is stigmatised. And unfortunately, the health aspects interlink with the mental health aspects and the many other aspects of weight. So one of the key things here is obviously to consider the background the woman has, ask her permission about how you're going to deal with that. And I'm going to hand over to Lisa here about this, but we can advise women on healthy lifestyle without specifically focusing on weight. And I think that becomes really important in pregnancy. So Lisa, do you want to kick off, and I'll perhaps then defer to Cherise?
So I think one important aspect here is to make sure that a woman's permission is gained before you talk about numbers on a scale, that you talk about the concept of weighing. And for some women, they may be happy being weighed, but they don't want to see the numbers themselves, and they don't want to have that communicated to them. So I think that is the first aspect, is to really determine whether weight is something that a woman feels comfortable talking about. Secondly, if you are getting the sense from a woman that this is something that she has some concerns about, in terms that there may be a different relationship with eating, then it's the language, I think, that the dialogue around healthy lifestyle is framed in. And so it shouldn't be about restriction of certain food groups. It shouldn't be about achieving certain exercise goals to achieve weight targets. It should be about lifestyle changes for the health of the pregnancy itself, independent of weight. So I think the language of the consultation can be conducted in as well, can be around that language. So that's my first comments on that. I'm not sure if anyone wants to jump in. I'm happy to continue that.
Well, maybe you have a second point, and then I'll go to Cherise.
Okay. So my second point, though, there is that there is going to be a link between healthy weight gain and the health of a pregnancy. And within that, there is obviously health around not gaining too much weight and not gaining too little weight. So I think there definitely can be clinical concerns about women gaining not enough weight. And so I think that is a really challenging discussion to have. I'm not necessarily sure we have the resources in our public health system to have the sensitivity of that discussion with women who do experience issues with that. I'd welcome your clinical insight with that, actually, people working in the maternity sector, because I'm working more in the preconception sector myself. So that's one point that I want to flag there.
Yeah, thanks. Cherise, did you have anything you want to add to that?
I agree completely with the previous comments. I think I see a lot of women in clinic when we're talking about weight, and it is a highly stigmatised area, and I definitely empathise with women around the complexities in the context of, pre-existing difficulties around restrictive eating. And I can definitely concur that it's not necessarily just about weight on a scale. It's very distressing, even outside of a restrictive eating, just generally with women, the concept of weight going up on a scale when most women, prior to pregnancy and in their earlier years, might be aiming for weight to go down on a scale. And so it's just psychologically dealing with that concept can be quite confronting for women. So I really believe that with a question like this, it really does come down to the support of the clinical team. And I agree with Lisa that sometimes those systems might not be well in place. But I think if there was heightened distress and anxiety around this, that it would be important to work in conjunction with midwifery team and obstetrics team to perhaps gain the balance between ensuring that the pregnancy is safe and healthy whilst balancing the distress associated with healthy weight gain that we know is a common part of pregnancy.
Yeah, and can I jump in there as well? Like, I think that's a really good point. I think maybe the practical tips of, I guess, assessing distress around weight gain by the healthcare providers involved in working with women, then changing the language around healthy lifestyle within pregnancy to be from weight to lifestyle behaviours instead, and just keeping that dialogue open with women and assessing that ongoing anxiety and stress as the pregnancy continues. Yeah.
Great, but obviously something that needs to be dealt with great sensitivity. And Lisa, I do agree that sometimes the system finds it hard to be able to nuance like that. I don't know, Kirsten or Daniel, if you had anything to comment on?
I think it's been fantastic advice from Lisa and Cherise, and one that I would wholly support. And, you know, I think certainly, like with every system, nothing is perfect, but, you know, it's certainly an area that as healthcare providers, we work very hard to try and minimise any undue anxiety and stress during pregnancy. We know it's a time that often can feel very overwhelming, and there's a lot for women to think about, and at times, particularly where they might not be feeling particularly well either. And so it is part of taking that really detailed medical history to understand, do they have a history of eating disorders? And doing that very early in the pregnancy before the significant physical changes start to take place, so that you've got that opportunity to be able to start to provide education and preparation for the physical changes that their body is going to go through, which is in and of itself really confronting for some people that have been very focused on their physical shape for a long time. And that in and of itself can be confronting beyond just weight on a scales. And I agree. I think that, you know, actually weighing on a scale is not something that we have to do. And if that's going to cause distress, then that's absolutely something that should not be part of that woman's pregnancy journey.
Yeah, great. Thanks, Kirsten. And I think it's always that trade-off. That's why you have the initial discussion, because the evidence is very clear that if we can advise women to stay within that healthy lifestyle, gestational weight gain, they have better outcomes. But there are many ways of doing that, and their mental health cost has to be balanced, like everything. All right, excellent. These are great answers, as we would expect from such fantastic experts. So we've only got a few more minutes left. I think perhaps the further, maybe a couple of other quick things. A lot of them are about diet and exercise recommendations. I think we touched on those. There is one specific question here, Nicole, I'll defer to you, which is the evidence on the use of mental health medications during pregnancy, including SSRIs, and then I'll refer to Daniel as well to see if he has any additional comments. But any comments, Nicole?
Yeah, again, so going back to the Australian National Guidelines, always get your information from reputable guidelines. But the guidelines do recommend that if you are experiencing anxiety or depression, either in pregnancy or when breastfeeding, SSRIs are the frontline treatment for moderate to severe depression or anxiety. So this is again where it's important to get help early, so you can treat it early before it becomes moderate to severe. But if a person is experiencing moderate to severe anxiety or depression, SSRIs is the number one first line treatment. Just being mindful that, again, because of misinformation, not only in the community, but also amongst health professionals, often we find that patients are being told to come off their medications in pregnancy, and as a result are relapsing at an already vulnerable time. So again, following national guidelines, SSRIs are safe to use in pregnancy and breastfeeding.
Great. Any comments, Kirsten or Daniel?
Yeah, just adding to that, SSRIs have been around for quite a long time now. We have a good amount of safety data on them, and often the harm that is caused by ceasing their use when the woman finds out she's pregnant is larger than the benefits that we get from the medication or the harm of staying on the medication. So our advice is usually do not change your medication regimen until you see a health professional who can give you good advice on that. And again, and both here on medication, but also on lifestyle, I think it's the importance of seeing women and families early in pregnancy and having this chat and managing expectations, or setting the expectations from a very early stage and potentially even before pregnancy when we can, because that makes everyone's lives a lot easier.
Yeah, definitely. I might just, thanks, Daniel. I might just make a final comment here that's in the chat around the issue with weight is that it's, you're absolutely right. Someone's made the point that it's often linked to individual personal behaviours, but actually we know weight is not a choice. Excess weight is not a choice necessarily for many people, and it's actually more related to the environment that we're in and the habits of those around us. So in fact, if this is done sensitively and appropriately, as I know it is by all the people on this call, it's actually around supporting women to navigate the not particularly healthy environment that we all find ourselves in, both before, during and after pregnancy, rather than making any judgments about individual behaviours. And I think the best outcome for this, we all know, would be good public health policy and an environment that actually allowed us all to be healthy. But with what we have at the moment, it's really about support and not about judgment. So on that note, I think we will perhaps leave it there. I want to thank our panellists very much. There's all those great resources from Nicole, Leslie and others in the chat. My take-home message is that I wish I had Mariam's advice before I had my children. But I think just really critical points here. Get your information before you're considering getting pregnant. Be well informed on evidence-based sources right through your pregnancy. Be really careful where you get your information so you're not being misinformed. As Daniel made those critical points about vaccines, which are incredibly timely at the moment. And do your best to be as healthy as you can and as supported as you need mentally and physically across this transition. You're doing a really important job, so it's everyone's job to look after you. So on that point, thank you very much to our speakers, and I hope that was useful. Thank you, everybody.